Alrighty, folks, welcome to another edition of the Healthy Way right here in Love 101 FM, the family station. Now we're continuing the conversation this morning on childhood cancer, or Gold Ribbon Heroes. With us this morning is Dr. Sharon McLean-Salmon, Paediatric Hematologist, Oncologist, and she's one of two in the island at the Bustamante Hospital for Children. How are you, Doctor? Sharon, welcome to Love 101.
Thank you. Thank you. Good morning, Chevauni. Good morning, everyone. I'm great. Thank you
Great.
for having me here this morning.
Very well, our pleasure. Now let's start with this one. What is the incidence of childhood cancer in the Bustamante Hospital for Children in Jamaica?
The first thing is, as you know, just like to emphasize that children do get cancer, right? It's kind of different from what adults get. And in Jamaica, I would say that we are seeing on average 1 to 2 new cancer cases every week, right, per year. And at Bustamante, we see ages 0 to 12 and approximately 30 to 35 new cases per year.
Is that frightening, Doc?
No, we don't panic.
Right.
We know that it exists and it is expected. It's not a large number as you see with adults,
Right.
but cancer happens. It's not a death sentence. That's difficult disease, but it's something that's curable. So we as doctors and medical team, we don't get frightened by it.
Right.
We're in a position to help,
Right.
to heal.
Right. Well, let's talk a little about the most common kinds of cancers, in Jamaica, and childhood cancers now.
All right. The most common type, if I talk about the top 4 or so, would be cancer of the white blood cells or leukemia, cancer of the brain, right? And the cancer of the kidney and cancer of special nerve cells called neuroblastoma. So those are the top 4 that we see, and it also resembles what the top 4 are all over the world. So we're no different here in Jamaica.
And then in terms of diagnosis, how do you know or suspect that a child has cancer?
In terms of how the parents and the families can know, the first thing I need to say is that as the medical team, we rely completely on the community to assist in bringing these children early, because early pickup is the best chance they have at cure. So the common things to look for is if you have a child, who is having a fever that you can't explain, it's prolonged, they've stopped eating, they don't want to eat anymore, they're less active, they're very tired, they may look pale, they may have swelling of their glands. The general public sometimes call them wax and cannon. They just swell up and they're just getting bigger and more coming on. The tummy might look like it's getting bigger and becoming more tough, right? And they may complain of bone pain, joint pain, generally unwell. Those are not children that should be watched at home. They should be taken to their nearest doctor and to get further evaluations done, including more from the history or the story, the examination, and any investigation.
Right. So as soon as we see signs and symptoms, we should just rush them to the hospital.
Yeah. Yes, to their doctor or the hospital, whichever is depending on what is happening. Right. Certain. Not keep them at home at all.
Right. Now, I want to bring COVID in the mix this morning, and so how do you know a child with cancer has COVID-19, and let's talk a little bit about the impact of the diagnosis as well.
All right. Well, COVID-19 pandemic is a rather stressful time, but we are not going to be daunted by it. We need to panic. Basically, these children with cancer present in a very similar way to others without cancer and adults. They may come to you with runny nose, sore throat, body pains, fever, headache, weakness,
Right.
want to sleep, not eating, just general sounding very non-specific symptoms. And in other times, you'd have said, boy, maybe it's a flu them have
Mm-hmm.
or the cold. But this is how it looks, right? Once, especially in this time, any of our patients present or come to us with any of these, then we're going to consider COVID because that is
Right.
what's going around now.
Right.
And we would do the necessary evaluation, which includes a swab to try and determine,
Mm-hmm.
confirm, or throw it out whether they have COVID or not.
Are they treated
Now, in terms,
differently?
hmm?
Are they treated differently?
um, well, sort of.
Mm-hmm.
Largely, the treatments overlap, but the treatment plan is is based on the fact that children with cancer will have higher levels of severe COVID and higher risk of death.
Right.
And so we are particularly concerned when a child comes, and we put things in place to make sure that we monitor them closely if it's mild
Mm-hmm.
or if they show the signs that require admission, like shortness of breath, that they're really lethargic, the parents can't manage them at home, then we'll have to admit and do the usual supportive care that is there. It's just that our we have a lower threshold to bring them into hospital for care, but there's nothing different in
Right.
terms of the treatment that can be offered to them if they actually get COVID
COVID.
19.
Right. All right. And should they receive the vaccine? Children with cancer, should they receive the vaccine?
The short answer to that is yes. Um, the problem with cancer and the concern would be that their immune system is weak,
Right.
right? The cancer itself weakens their immune system. The treatment to get rid of the cancer also takes a toll on the immune system. But the vaccine has been shown, even in this group, to um, be effective. It may not be as effective as someone without cancer, and as such, this group is also being considered to get a third vaccine just to see if we can boost their immune system
Mm-hmm.
later. But certainly to protect them from COVID, especially since it's a higher level of severe illness
Right.
than the general population. So we don't want them to go through that. Plus, the impact of it would be, if they get COVID, we'd have to stop their cancer treatment until they get better. Once they stop the treatment, then the outcome that we're looking for, which is cure, may be compromised, and we really don't want them to have to experience COVID as much as possible. So yes,
Right.
but
Right.
in discussion with the doctors
Right.
who take care of them to know the best time.
Yeah. Well, listeners, we're having a chat this morning with Dr. Sharon McLean-Salmon, pediatric hematologist, oncologist at the Bustamante Hospital for Children. We're talking about childhood cancer. We're continuing the conversation this morning, and there are gold ribbon heroes, right? And so we really want to take some time to just remember all our children fighting cancer. Now, Doc, let's go through some side effects of the vaccine in children with cancer. Walk us through some of them.
All right. So the children with cancer will experience or may experience side effects just like any other child without cancer or adult or an adult.
Mhm.
So they can get soreness at the site where they get the injection, little
Right.
swelling, little pain. They can get nothing at all. They can get pain, that generalized malaise or tenderness. You feel a little tired, maybe
Right.
a little fever. But whatever the symptoms are, it doesn't last more than about 2 days. And so we would then tell the parents whose children will be getting it about what to expect
Mhm.
and what to do if those symptoms come, which really would be symptomatic control. Make sure they get the fluids and the Panadol
Mhm.
and so on to help them to feel better.
Right. And if they had COVID, they should still get the vaccine, right?
Yes, they should, but the timing is what would have to be discussed with the
Mhm.
doctor.
Right.
So generally, we recommend wait for maybe up to 6 months before getting the vaccine if you have had COVID, and it's going to be the same in this group. But there are other considerations that we make. Where is the child's immune system since they're going through the chemotherapy? When is the best time that they feel the strongest in terms of their immunity to accept this vaccine? So that's a discussion we would have with the families about the next steps relating to this.
Right. And there are talks of face-to-face, return to face-to-face schooling. So is it okay for children battling cancer to return to face-to-face given the pandemic?
Okay, that's quite a topical point. There is no real easy answer to that. To any group, even more so this group where the immunity is a problem. So even without COVID-19, we have to sit down and consider this with the family. When is the best time for them to go out to school? But now that we are in the pandemic, there are certain things we consider. We consider where they are in terms of their treatment. If they're on treatment, how is it impressing their immune system? If it is during a treatment time when the immune system is very, very little, then, and especially in the context of the virus still being quite prevalent in the community, then we would recommend an online plan, right? We also consider whether or not the child is able to comply with the rules. Those things would have to be considered, whether they'll keep on the mask when mommy and daddy is not there, whether they'll social distance and washing of the hands, whether or not the school community is having a robust set of plans for COVID prevention. Are they strict with the rules of keeping a mask on, of social distancing and so on, and frequent hand washing, and whether or not the school understands that this child can become ill, and there is a plan in place to deal with that situation, or any child becoming ill, especially in this COVID time. That it's not something that would be missed or ignored, but something that will be taken care of. Whether the parents are comfortable with what they see of the school, but once all those check boxes are ticked and in a positive way, then there are different options, whether it's full online, depending on the situation, or a hybrid plan, online plus face-to-face or face-to-face. Certainly, the further out they are from treatment, like, more than 6 months, then it's more likely that we'll be okay with a face-to-face plan, as long as the other concerns are addressed. So it's not an easy answer. It is case-by-case basis, and it's something we'll have to work through with the family.
Quite a
see
task.
how this can happen.
It's quite a task. And before almost out of time, regrettably, but I want to hear your recommendation. How can we as a society help to protect these children?
All right. Good question, Chevauni. As a society, I think if I think about this one, not in any particular order, certainly prayer. So we have to pray for our nation. We have to pray for these children. We have to pray for them to get better and to be protected as much as possible. The next thing as a society we can do, I've not mentioned this before, but is organize to donate blood. Each person listening here can get on board and, make their way to make a plan to go to the blood bank and donate blood. And the importance of this is that this is an absolute important part of their treatment, and sometimes it saves lives in this group of children because their counts go low and they need this support. And sometimes when we turn to the blood bank, we are disappointed because we don't have enough donors having come in, and so it takes a longer time for the children to get access to this well-needed product, which sometimes save their life. So that definitely something. Organize your blood drives, go to the blood bank, and so on. And the last thing, and as I said, not in any order, is get vaccinated, because the more persons that are vaccinated in the community, the less likelihood there be of variants, the less likelihood there's spread, and the less likelihood that these children will be affected. About 20% of children with cancer will get severe COVID, and that represents about maybe 4 to 5 times more likelihood of getting severe COVID than another child without cancer.
Right.
And of that, 4% of them will not make it. So just to help out the situation, protect these children, vaccinate. And anybody who is eligible should try to get themselves vaccinated.
Wow. Wow. Quite a mouthful, but I stand with you. And I know it must be a very difficult task, right? And I
Yeah.
see that you're one of two oncologists, hematologists at the Bustamante Hospital for Children.
Yeah.
Um, and so we continue to keep you and the other doctors in our thoughts and prayers during this time.
Thank you.
Yeah, keep up the good work, Doc. Thank you.
Thank you. And same to you, and all the best to everyone.
Thank you. Really
All
nice.
right.
Very well. Really, really nice. That's our talk this morning. Childhood cancer. September is Childhood Cancer Awareness Month, right? Dr. Sharon McLean-Salmon, their pediatric hematologist and oncologist at the Bustamante Hospital for Children. Really nice. Auntie Jen, how are you? Thanks to Dr. Angie Burton. This is Love 101, and it is the fabulous station. Please do stay with us.
Love, that's where it is. Love, we are a family. We're here to serve.